Hello, I'm Dr. Bravian, General Medicine, MD General Medicine in Supreme Hospitals, and today I will be talking about a problem that is seen very often but goes unnoticed in the society, the problem of thyroid disorders. So most of you would be aware of thyroid disorders, so I'm just here to give a small intro to what is thyroid disorders. Is it something that is worrisome, or is it something that can be treated, can be cured? So how do you manage it? How do you go forward? To start with, we all have a thyroid gland, and it is necessary for generating hormones for the body that is required at various stages, mainly associated with the development of different structures and milestones. What we are going to talk about thyroid is we have two conditions. We have hypothyroidism and we have hyperthyroidism. So this thyroid gland, we are going to talk about hypothyroidism, meaning when the thyroid gland functions less, and hyperthyroidism when the thyroid gland functions in excess of what it has to do. So both of them will create problems. So we have people who come to us with symptoms of neck swelling. So they come to us saying that, doctor, I have noticed for the last few days or months that there is a swelling in the midline of my neck, and it is just there. I have just noticed it like that. So one, it could be one of the swelling that could be arising from the thyroid gland that they have come to see our attention. And next, it is incidentally picked up in mastoid checkups when we do a regular screening modality wherein we find some thyroid parameters abnormality, and then we go in for consult. So to talk in general about what is hypothyroidism. Hypothyroidism is due to the underactivity of thyroid gland, wherein the secretion of the hormones are less by the thyroid gland. So what are the complaints a person can come with hypothyroidism? With hypothyroidism, a person will complain of sudden weight gain, lethargy to do activities, prolonged sleep durations. Women will have menstrual irregularities. So these are the commonest problems that they come with hypothyroidism. Cold intolerance, and next we have another per se, which is hyperthyroidism. So in hyperthyroidism, wherein the thyroid gland works in excess, we have the complaints brought by the patients will be palpitations, which is awareness of one's own heartbeat beating fast, heat intolerance, profuse sweating, decrease of sleep time, excess of activity, wherein they will appear to be thin built. Women will have menstrual irregularities, and so these are the complaints. So women in our society is more screened because during their pregnancy, during their reproductive age group, they have a panel for thyroid checking. It is the men who go unnoticed that we do not check unless they bring these symptoms. So once a symptom is brought, how do we manage? How do we go forward in this? So first and foremost thing is, I would like to know whether it is hypothyroidism or hyperthyroidism. Both hypothyroidism and hyperthyroidism affects males and females equally, though females are much more predominantly affected than male, but more or less it is equal. Symptoms of both of them are also equal. So if you have these symptoms, you can come and meet the physician, and we will be able to do a thyroid profile to see how it functions or not. So does thyroid run in families? Yes, thyroid is also genetically predisposed, meaning if your parents have thyroid, there's a high likelihood that you or your siblings will also have some thyroid disorders. Now, when we have this thyroid disorders, can it be rectified? Can it be cured? Now that goes into the next step. Basically, like if you have a thyroid disorder, we need to evaluate and find whether it is hypoactivity or hyperactivity. Based on that, we will actually do certain blood parameters to arrive to that particular diagnosis, and once we arrive to that particular diagnosis, we initiate the treatment. Initial management is always medical management, and for hypothyroidism, wherein the gland is underactive, not producing much of the hormone, we actually supplement it with a thyroxine supplement. For the ones that are hyperthyroid, we go in for anti-thyroid medications, and these are medications which slow down the thyroid and make it to come into the normal level. So thereby, a person gets relieved from the symptoms. Now in both of them, we need to take these medications throughout our life. Maybe the dosage will vary as per our requirements and as per different stressful situations, but other than that, these are to be continued towards life. So is there any side effects of taking this? No, definitely not. Thyroid gland is a normal thing in the human body, and we are just giving you the medications to bring it under control, to normalize them. So definitely it's not going to cause any other further thing. Now in hypothyroidism, it is one of a very important thing that is seen in pregnancy, wherein it has to be treated with utmost care, or else the developing child might not have good neurological development. So for that, we have to supplement supplement the mothers with thyroxine and also see that after the medication the thyroid gland is in euthyroid state. If it is hyperthyroidism, then we need to give the patient anti-thyroid medications and this will try to slow down. Now come back to hypothyroidism. Hypothyroidism, the treatment is a little more elaborate because you have a medical management, and if it doesn't work in medical management or it requires a high dose of therapy, we might have to go for other invasive procedures wherein you will have to ablate the overactive thyroid gland. So this being done, once the medications or once the treatment is done, the person will have a marked relief physical activities, their well-being will improve and all their conditions and all their symptoms will decrease and they will feel much better of this. So this is certain things that should not be under-evaluated. So now it is frequently common we are having all these things. So you have to meet the physician at time, get it treated and get a proper follow-up to see if it is in control or not. Now once a medication is started and the thyroid disorder is in control, how often should my follow-up be? So initially we will ask them to follow once a month for the next 3 months, and if we find during the next 3 months visit that all the parameters are within normal, then he has to make at least one visit every 3 months. So that is mandatory, so that we have to find out if the dosage requirement is adequate or should we step up or step down. So this is how we manage hypothyroidism and hyperthyroidism. Thank you.